So here is your station. Once you're ready, you can tell us. We'll begin.
Okay. Okay.
Okay, so if you have read and understood, considering it communication skill station, please begin.
Hello.
Yes, hello.
I'm Dr. Ali Bade, SHO doctor working with Mr. Mann in London Hospital. I'm calling to speak to the ITU registrar. Can I confirm that I'm calling the ITU registrar?
Yes.
Okay. I'm calling you to ask you advice about patient that I'm worried he developed post-operative
I'm
oliguria.
sorry. I am a consultant on call. Do you want a consultant on call?
No, I need ITU registrar.
Okay, go ahead.
Okay, sorry. Okay. I'm calling you to ask you advice about the patient that I'm worried that he developed post-operative oliguria.
Yes, okay.
Okay,
Summarize.
yes, I have a 69-year-old lady, day one post-operative right hemicolectomy for cecal tumor and also liver biopsy. And intraoperative course, there is a minimal bleeding and the patient received 2 units of the blood. But today she become hemodynamically unstable. There is hypertension, tachycardia, and I noticed that the urine output, there is low urine output, and I checked the fluid chart. The patient received only 1100 of normal saline in the last 24 hours. On investigations, the creatinine and urea is rising. There is normal chest X-ray and normal ECG. And on my examinations, the abdomen is soft and lax. So I'm calling you to ask your advice for.
Okay. So, what do you think the cause is?
Yes, I think this patient developed due to dehydration. This patient developed post-operative oliguria.
Why do you think that is the dehydrated patient?
Yes, because this patient is receive a minimal amount of fluid. It is only 1100 of normal saline in the last 24 hours.
Okay, so why creatinine is high?
This is due to the dehydrations and leading to the vasoconstrictions and renal tubular necrosis that causing acute kidney injury.
Okay, so what is the plan of action of you going to do for this patient?
Yes, I will start fluid chilling by giving patients 250 ml to 500 ml of normal salines in the 15 minutes, and I will repeat the bolus for the fourth time if there is no response. And also, I will consider blood supply for this patient.
Okay, so if there is no response, what are you going to do?
I'm going to update you again, and also I'm going to call ITU registrar and for the central venous line insertion and blood transfusion accordingly.
Okay, and how will you monitor this patient fluid response?
Okay, by blood pressures, capillary fill times, respiratory rate, pulse rate, and mental status of the patient, and also central venous pressure, and also urine output.
Okay, do you think the patient is bleeding?
The bleeding is one of the differential diagnoses, but for now, the abdomen is soft. I'm going to monitor this patient vital sign, and also I will do serial ultrasound to exclude this complication.
Okay, so what's the sign of hypovolemia and how to know patient is bleeding?
The hypovolemia, it is the patient is will be hemodynamically unstable in spite of the fluid resuscitations and blood transfusion, and also the abdomen will be rigid, and will be tenderness of the abdomen, and will be there is distension in the abdomen.
Okay, do you think it's the anastomotic leak?
The leak also one of the differential diagnosis, but for now the abdomen is lax, and if the patient develop a sign of peritonitis, I will update you.
Okay, do you need me to come back?
For now, I will start the fluid challenge, and then if there is no response, I'm going to update you.
Okay, that is right. And does he require HGU transfer?
If there is no response to the fluid challenge after 4 time, he need HDU transfer.
Okay. Does he require an operation now?
For now, there is no need for operation now because there is no sign of bleeding, internal bleedings, and no sign of anastomotic leak.
Okay. So if HGU is full, who are you going to speak to?
I'm going to speak to the bed managers. I'm going to tell him about the urgency of my case by repartitioning the patients or step down the most stable patient.
Do you think the patient is shocked? And what is the cause of this shock in this patient?
Yes, the causes of this shock because the patient is received because the patient is dehydrated and receive only a small amount of fluid.
What is the type of shock do you think the patient have?
This may be hypovolemic shock, And if patient develop infection, will be septic shock.
What do you do to do fluid channel him, and what is the dose?
The fluid channels, I will start by 20 ml per kg as a bolus dose.
Okay. And that patient need hemodialysis?
Now there is no indication of hemodialysis.
So what is the indication?
What?
What is the indication?
If the patient has intractables, hyperkalemia, severe more than 6.5, and or if there is severe acidosis less than 7.2.
Okay, please summarize your case.
Yes, I have this patient. He developed post-operative oliguria, and I will start fluid challenge 250 to 500. I will repeat it four times. If there is no response, I'm going to calling you again. I will prepare patient for transfer to the HDU.
Okay, thank you. Can update me.
Thank you very much.
Thank you.